Good morning, everyone. Thank you for joining us for today's webinar, UPMC Community Health Choices, Nursing Facility Contracting and Amendments. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. This webinar is being recorded and will be made available on the PHCA website by the end of the day today. Today's webinar is informational and not for credit. Feedback is important to us, so we'll be sending you a survey following the webinar. Please complete this survey, and if you're participating in a group setting, have each participant also complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit your questions using the question pane on the right hand of your screen, and we're going to be handling questions a little bit differently today. We will not be handling the questions live, but we will be answering them through a Q&A document, which we will get back to you within a couple days. So please feel free to enter your questions, and we will be getting the Q&A document back out to everyone in a little while. So now for today's webinar. This webinar is being presented by Danielle Rupert, Provider Account Executive with UPMC. The webinar will provide an introduction to and discussion around execution of new contracts and amendments to current provider agreements for nursing facilities located in the southeast zone of Community Health Choices. Your learning objectives include an introduction to UPMC CHC and a review of contracts and amendments for Southeast nursing facilities, a review of rate sheets, and hearing what's next, future activities and communication. I'll now turn the webinar over to Danielle.
Thank you, Wendy. Good morning, everybody. As Wendy said, I'm the Provider Account Executive for UPMC Health Plan. I handle the nursing facilities exclusively. My director, Andrea Farrell, couldn't be here today, so I'm presenting on her behalf. But my contact information will be on the last slide. Feel free to email me any questions you have, or just use the question function through the WebEx, and we'll get those answered for you. So to start out, I'm going to start with the amendment that was sent out. This was only sent out to the nursing facilities that currently have a contract with us, since we can't amend something that doesn't exist. If you have not received a contract from us yet or an application, please feel free to email us, and I will get those out to you as soon as possible. Oops, not that one. Sorry, one second. Okay, so here's the amendment that is adding the nursing facility services, and then it's also adding the Community Health Choices product. The amendment just goes over how we are paying you, but really the rate sheet's going to be more specific to that. So this is just all the standard contracting. So I'm going to jump over to the rate sheet, and we can go over each item. So we're handling the billing the same way that you submit to DHS. The Southwest is currently billing this way, and we're not having any issues at this point. You're billing us revenue code 100, and your per diem rate is the 4 quarters from 2018. It's the average, and then also in that rate will be if you qualify for event trach payment or also a disproportionate share. So transportation, there's going to be a memo that's coming out from DHS regarding this, but it is included in your per diem rate, and the nursing facility is responsible for that coordination. Hospital reserve bed days. The nursing facility must be at 85% occupancy per DHS published quarterly reports. You will be paid 1/3 of the current per diem rate, and you are eligible for a maximum of 15 hospital reserve bed days per hospitalization. And this is all the same that it is currently with fee-for-service. Therapeutic days is revenue code 183. It's reimbursed at 100% of the per diem rate, covered up to 30 days per calendar year. One thing I do want to say is that authorization is not required for CHC. Because you're being paid that flat per diem rate, we're not paying based on a level of care. You don't need to complete an authorization. Same with respite, no authorizations required for that. We just ask that you coordinate it through the service coordinator that will be in your facility, and it's reimbursed at the per diem rate through revenue code 100. And that goes the same for hospice. And then the hospice provider will be reimbursed directly from UPMC Health Plan for the hospice services. Okay, jumping back to the PowerPoint, I do want to touch on OME and DME. These are still reimbursable via the claim form, but these should really be going down. It's a new process where the DME provider is going to be billing us for those services, so that leaves the nursing facility out of that payment. The DME provider will obtain the authorization, and then they will bill us those services, and then we will pay the DME provider. We are trying to build our network for OME, the dentists, the hearing aid providers, and then the DME providers. If there's someone that you are currently using that you want to make sure that we contract with, feel free to drop us an email and let us know who those providers are, and we'll work with them to get a contract in place. Okay, so the amendment and rate sheet, those were sent out last Friday. We are asking for those to be returned by this Friday, tomorrow, August 3rd. If you have questions regarding those, feel free to drop us an email to nursingfacilityinfo@upmc.edu. To note, you won't be included as a participating provider in our directory or our online directory until we received a signed amendment. Okay, so for vent supplies, this is handled exactly how it is with DHS currently. It's code 94004. There's an $80 limit per day. The claims are submitted directly to UPMC Health Plan, and then we pay the nursing facilities for those claims. Supplemental payments, Appendix 4, those are calculated by the nursing facility organizations. They let the MCOs know how much each facility is owed, and then we cut the check for those. And you will receive, however you receive your current claims payments, either EFT or paper check. Disproportionate share, we'll use the recent quarterly picture date. The data is available from DHS prior to each calendar year. This payment will be baked into your per diem rate. As far as next steps, UPMC is going to be conducting orientation sessions. Those could be in a group or individual. We'll also be working with the other MCOs to coordinate training together, like we did in the Southwest. We'll cover claim submission, billing methodology, processes, procedures, our provider manual, and make sure you have all the contacts that you need at UPMC Health Plan. If you haven't heard from us yet, please feel free to drop an email and I will get you out the application. And there's my contact information, and please let us know if you have any questions.
Thank you, Danielle. We appreciate your the information today. And I do see some questions coming in. Keep them coming. I'll leave the line open for a while, and we will get back to you with answers to your questions. So I will leave the line open for a little while longer, as long as I keep seeing the questions coming in, which I am seeing them come in. So please go ahead and type your questions in, and I'm going to just put you on mute. And like I said, I'll leave the line open for a little while longer, and we'll get back to you with the answers to your questions. Again, I'm seeing great questions coming in. Keep them coming. We will get these over to Andrea and to Danielle, and they will update the document for us and get back to us. So please keep your questions coming. Thank you so much for being on the webinar today. We really appreciate it. Keep your eyes out. We've got a lot more webinars coming up this month and scheduled through the rest of the year, so keep watching for more webinars. We do have several scheduled again later this month and into September and October, so keep your eyes peeled, and we will so most of those are for credit webinars, but some are going to be with some of the other plans, so those will be informational and not for credit. But again, watch for information on upcoming webinars. I see the questions are still coming in. Yes, we will make the PowerPoint available. I will be sending that out later today along with a recording to the webinar. I'm hoping that UPMC will be getting those answers back to your questions rather quickly. And we will get those back out to everyone as soon as we have the information from UPMC. So I will, again, leave the line open for a little while longer. Please continue to send the questions, and we will pass those on to UPMC today. Please continue to type in your questions from today's webinar that was presented by UPMC Community Health Choices on nursing facility contracting and amendments. I'm sure there are a lot of questions, and UPMC will be handling those. Instead of handling them live today, they will be handling them through a Q&A document, which we will get back out to you. So if you do have any questions, please go ahead and type them in. And also, Danielle did provide her contact information in the handout, which I will be sending out later today. So you can feel free to reach out to them at any time with any questions that you have, following today's webinar. Keep the questions coming. I'll keep the line open for about another 5 minutes, and then we'll close it down. I'm seeing questions continuing to come in. They're great questions. And again, please type in your questions. We will be sending this out to UPMC immediately following here, probably about 10:30. Hopefully they will get back to us with answers to those questions, and we will get that back out to you all as soon as we can. Again, thank you for being on today's PHCA webinar. We appreciate your attendance for our webinars, and keep your eyes open for more webinars to come later this month and into the fall. For those of you who are still on the webinar, thanks for your questions. Please keep them coming. I'm going to keep the line open for a while longer. I'm still seeing questions coming in, and they are really good questions. So we will, as soon as we hit about 10:30, I'm going to close it down and download the report to send to UPMC so that they can get a jump on answering these for us, and we'll get the answers back to you as soon as we can. We're going to give it about 5 more minutes. At 10:30, I will go ahead and close the webinar line. Please keep your questions coming. We will take those and send them over to UPMC as soon as we download the report. They will have the questions, and we'll turn around a document to send back out, which we will send to all of you on the call today, and even those that weren't able to join us will have access to the answers to the questions from today's webinar. So please keep your questions coming. They're great questions. We appreciate your time and for bearing with us. We had a little bit of not technical, but we had some difficulties in scheduling today, and wanted to make sure that we got you all the information, and wanted to be sure to give you the opportunity to ask your questions, and UPMC has committed to answering those questions in a document versus answering them live on today's webinar. So look for those answers, that document to come out. We're not quite sure of the timing yet, but hopefully they can get that turned around pretty quickly. So keep your questions coming. We've got about 3 more minutes. We've got about another minute. If you have questions, please go ahead and type them in. As soon as we shut the broadcast down, we will take those questions and send them over to UPMC to get back to us for answers. So we got about one more minute. We'll take it to 10:30, so keep the questions coming. These are great questions. We appreciate your time today, and look out for other PHCA webinars coming up. Okay, we've hit 10:30. I'm going to go ahead and stop the broadcast. Thank you again for attending today. We appreciate your time and your patience. This webinar was a little bit different, but we are going to get the questions downloaded now and sent over to UPMC. Sit tight, look for an email back from PHCA with the answers to the questions that UPMC has committed to answering for us. So again, thank you for your time today. We appreciate it, and we'll hopefully catch you on the next webinar.